السلام عليكم.
वालेकुम अस्सलाम सर।
वालेकुम सलाम सर।
वालेकुम सलाम।
वालेकुम अस्सलाम।
Okay, guys, we almost finished all procedures. We still have supervision and teaching. So we are talking about ECG, EBG also, and um, some stations like Boldale or anything like that. Okay. So as we mentioned, procedural skills, 2 stations, and supervise and teach 2 stations. Here in ECG or ABG, don't follow this approach. Why? Did they ask you to do ECG or teaching how to do ECG? No, how to interpret ECG, right?
Yes sir.
Yes.
So if they ask you teach how to do ECG, it will be procedure. So you will follow pre, during, and post. But it's not procedure, it's interpretation. It's a different here, clear? And in ABG also, it will be the same. They ask you to teach interpretation, not to do the procedure of ABG. Clear, guys, this point?
But sir, we
Yes,
will
sir.
continue with the same first 2 questions. How much do you know and
Yes,
give me
of course, you will follow the general approach of teaching, but not the general approach of procedure.
Okay sir, yes.
Okay, so we will discuss now ECG and ABG, toxicity management, and bold elbow. So in ECG, you will follow the general approach of teaching. Good morning, I'm Dr. Blah, 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 one of the ED seniors. May I know your name and grade? Robert, nice to meet you. I believe you have something to discuss with me regarding what?
ECG.
Regarding
ECG
what?
Interpretation of
Interpretation of an
Interpretation
ECG.
not ECG. Interpretation of ECG. Clear now?
Yes, sir.
So how much do you know so far about that? Anything specific you want to know? Okay. Today I will set learning objectives for you. I will teach you the basics. So I will teach you. You can write, guys. Number one. What do you think?
leads.
First, the
Leads. Number 2.
Square.
paper speed.
Square.
Paper,
heart rate.
Number
Parts of ECG.
second.
Leads. Number
Second.
2 waves.
Seconds. Number 1 leads. Number 2 seconds. Number 3 squares. Number 4 heart rate
Wave.
waves. Number 4 waves. Number 5 heart rate. Number 6 heart rhythm. Number 7 heart axis. Please write. Okay.
Yes sir, right.
Next will be diagnosis. Next will be management. Clear now the learning objectives?
yes, sir.
Okay. So leads, you will mention quickly. You have 12 leads. Number 1, 2, 3, AVR, AVL, AVF. V1 to V6. Done. Okay. So regarding the seconds, you will mention each lead, how many seconds?
2.5.
2.5.
2.5 seconds. And the last strip could
10
be
seconds.
10
10
seconds.
10 seconds. It could be V1, lead 2, V5. Okay. V1, lead 2, or V5. Done. We will go for squares. Each large square, how many seconds?
0.2 seconds.
0.2 seconds. It contains 5 small squares, and each small square 0.4
Point
0.04
point zero.
0.
second. Okay, we finished now the squares. Okay, we will go for
Waves.
waves. The normal wave BQRST. BQRST. Even you don't see BQRST, no problem. Just mention, just verbalize. Don't care about the actor if you understand or not. Sometimes the actor is not in medical field. Okay, so finished. Then you will talk about B wave. B wave, it seems, or represent atrial depolarization.
Repolarization.
QRS represent ventricular depolarization. T wave represent ventricular repolarization. Done. If you don't find any normal wave, mention that. For example, you can say here no B wave. Here QRS narrow. So if you find any abnormality, mention in the same time, because we are in waves. So if you find any abnormal waves, mention them. Clear, guys, this point?
Yes, sir. Yeah.
Yes, sir.
Okay, we finished waves. We will go for heart rate. Heart rate, it means 300 divided by large squares between RR. So here it should be 60 to 100. Here 1 square or almost 1 and plus. So it seems like 300 divided by 1 and point half seems like 175. Okay, then we will go for heart rhythm. Heart rhythm, it should be sinus rhythm. It means B wave should be present and should be regular. But this ECG, B wave is absent and regular. Clear now?
Yes, sir.
We finished now the heart rate. We finished the rhythm. Then we will go for axis, heart axis. Check lead 1 and lead 3. Lead 1 and lead 3. If you find R dominant in lead 1 and lead 3, it's a normal axis deviation. Okay? If you find the lead 1 only dominant R, means left axis deviation. If you find lead 3 only R dominant, it means right axis deviation. If you find the lead 1 and the lead 3 both negative deflection, it means extreme deviation. Clear, guys, axis?
Yes, sir.
Okay. So after axis, we will go for
Gnosis.
Diagnosis.
diagnosis. So you will mention the diagnosis. This ECG is supraventricular tachycardia. Why? Mention the findings. You can say absent B wave, narrow QRS, regular, and tachycardia more than 150. Done. After diagnosis,
Management.
management. You will follow tachyarrhythmia algorithm. Fix this approach, guys. You will keep the patient where?
In
Resuscitation.
research,
Resuscitation.
Connected to
cardiac
Heart
monitor.
monitor.
cardiac monitor. And you will take blood sample for routine, including heart functions or cardiac enzymes. Okay. You will call cardiologist. And you will do examination for the heart and the lung. Easy, the management plan.
Yes.
Yes, sir.
Fix this in all ECG interpretation. Navid.
Yes, sir.
Okay. Navid, Kashif, Zishan, and then Rodra, Farzin, Imran.
Yes, sir. My other colleague did not practice before, so they can proceed. No
Yes.
problem for me.
Who did not practice?
Me, sir, Dr. Imran.
Okay, Imran. Yes. So you will teach the junior doctor or the nurse about ECG interpretation. Okay.
Thank you.
Sometimes the nurse will say, I know the basics. from the beginning, she will say, I know the basic. You will teach her the basics.
No,
So you will start from where?
from the findings.
Or from sutures? Okay. So start from the point she mentioned.
Okay.
So she said, for example, I know the basic. Excellent. So do you know the heart? Do you know the leads? Do you know the seconds? Do you know the squares? Do you know the heart rate? So any point she will say yes, go for the next one. Clear?
Yes, sir.
If she said yes, I know the heart rate, and the axis she said no, I don't know the axis, then you should start from the axis. Easy?
Easy, sir.
Yes.
Yes, sir.
Okay. So you have 30 seconds and 6 minutes.
Hello, good morning. I am Dr. Azim Imran. May I confirm your name and grade, please? Nice to meet you. I believe that you are here to discuss something with me, especially the interpretation of the ECG. Anything specific you want to learn? Today I will teach you the ECG. First of all, I will set the learning objectives. I will teach you today the squares, then first of all the leads, then seconds, then squares, waves, heart rate, rhythm, axis, diagnosis, and at last the management. Do you know what are the different leads of the ECG? Okay, I will teach you. There are the 12 leads. These are limb leads and chest leads. Limb leads are 6, 1, 2, 3, AVR, AVL, AVF, and chest leads are 6, V1, V2, V3, V4, V5, V6. How many seconds in each lead? 2.5 seconds. And in long strip, there are 10 seconds. And what is the squares? Small square is 0.04 second and large square is 0.2 seconds. What are the waves? These are the PQRST waves. The first P wave is the atrial depolarization, and then the second wave is the QRST complex. The QRS denotes the ventricular depolarization. Are you with me? Is it clear? And then the T wave is the ventricular repolarization. Then comes to heart rate. We calculate the heart rate by dividing the 300 over the number of large scale between the two R waves. Now, for the heart rate, we have to know about the rhythm. Either it is a regular or irregular. Here, it is a regular rhythm. So the heart rate here is 300 divided by 1.5. It is roughly about 175. The rhythm, how we calculate the rhythm? We compare the distance between the two R waves. Here the rhythm is regular. Now we talk about the axis. For the axis, we look into the two leads. That is the lead 1 and the lead 3. Most of the deflection, a positive deflection in the lead 3. If we see the dominant R waves in the lead 3, then it is the right axis deviation. If the dominant R wave in the lead 1, it is the left axis deviation. If both are positive deflection, it means normal. Then comes to the diagnosis. It is a SVT, that is a supraventricular tachycardia, because there is no P wave and the QRS complex is narrow and the rhythm is regular. So what is it clear so far? Now we discuss the management. We follow the algorithm of tachyarrhythmia and we keep this patient into the resuscitation room. We connect the patient with the cardiac monitor. We call the cardiologist. Then we examine the patient heart as well as lungs. We extract the blood and send the blood for routine hematology biochemistry, especially the cardiac enzyme. Then we will do the vagal maneuvers if it is stable. If not recover with the vagal maneuver, then we will give the medicine, that is the adenosine. First 6 milligram dose, then we will do the 12 milligram. If not settled, then give the 18 milligram, maximum 36 milligram. Then if the patient is not vitally stable, it means the unstable tachyarrhythmia, then we will do the synchronized cardioversion. Is it clear? We go the synchronized cardioversion with 70 to 120 joules, biphasic cardioversion. Is it clear? Anything specific you want to learn? Then at the end, I will provide you the different resources and the website links for your future learning. Thank you very much.
Okay,
Now,
so we have 1 minute and 12 seconds. Okay, how many marks, guys, will give Amra?
10 marks.
9.5.
Sir, he forgot how much do you know so far?
He didn't ask if the patient knows the basics. He just assumed the doctor doesn't know basics.
oh yes, yes. You are
And
all
when
so
you
much
say-
smart and active.
And sir, other thing, he's copy pasting you. This not by his mind.
And when explaining why it's SVT, he didn't say because the heart rate is above what. He just said there's no P wave and QRS is
Yes.
narrow.
Yes, I forget it, and when I come to know that I missed because when I am talking about the waves, I should verbalize over there that the P wave is missing.
Okay, so I think he did very well, almost done. So I will give him 9 marks. Okay, so I think he's not rushing in time. Despite that, he finished within almost 4 minutes and plus. Okay, excellent. So here, did he mention keep the patient in resuscitation?
Yes.
Yes.
Call cardiologist, examine
Yes.
heart and lung,
Yes.
including heart function or cardiac enzymes.
Yes.
Okay, so by this way, you are in safe side. Then you will go in specific management if you have time. So you will say, follow the tachyarrhythmia algorithm. So if the patient is stable, you will go for vagal maneuver, then adenosine 6, 12, 18. If the patient is unstable, you will go for synchronized DC shock. Did you mention synchronized DC shock?
Yes, sir.
Yes.
70 up to 120.
Yes, sir. I told.
Yeah.
No.
Yes,
No,
sir.
no.
Yes, sir. He told.
Yes, ma'am.
Well done. So next one.
Me, Kashif.
Kashif. Okay. You can proceed. You have 30 seconds and 6 minutes.
Okay, sir.
In ECG, if you don't know the diagnosis, no worries. Just follow the general approach. You will get 10 out of 10. Even you don't know the diagnosis, yes. Okay?
Okay, sir.
Yes. Can I start?
Good evening. I am Dr. Kashif, ED Registrar. May you confirm your name and level, please? Nice to meet you. I believe that you have something to discuss with me regarding the ECG interpretation. It's very important to have a knowledge of ECG interpretation while working in ED. How much do you know so far regarding the ECG interpretation? Anything specific you want to learn today? I will set learning objectives for you. I will teach you today the basics of ECG, ECG leads, seconds, squares, waves, heart rate, heart rhythm, axis, and after that in interval or segments, and specific diagnosis and specific management. Is it clear? Okay, we will proceed. ECG is basically the reflection of electrical activity of heart on the piece of paper. First of all, whenever you see any ECG, just confirm that the name, date, and ID number of the patient, that it belongs to the same patient. Also check the speed of ECG is 25 millisecond and voltage, it is 10 millivolt. After that, the ECG consists of 12 leads, 6 limb leads, and 6 chest leads. Lead 1, 2, 3, AVR, AVF, AVL are the limb leads, and lead V1, V2, V3, V4, V5, V6 are the chest leads. Is it clear? If you feel any confusion at any point, just let me know. And each lead consists of 2.5 seconds. And at the end of at the bottom of the ECG, there is a rhythm lead, a rhythm strip. It may be lead 2, lead V1, or lead 5, and it is of 10 seconds duration. Is it clear so far? Then the ECG contains large squares. Each large square is 0.2 seconds, and in each large square there are 5 small squares, and each small square is of 0.4 seconds. 0.04 seconds. Is it clear so far? Okay. Then we will proceed for the waves. Positive or negative deflection with respect to the isoelectric line. These are called waves. If they are above the isoelectric line, they are positive deflection. And if they are below the isoelectric line, they are negative deflection. And in ECG, we have P wave that represent atrial depolarization, QRS complex that shows ventricular depolarization, and T wave that shows ventricular repolarization. Is it clear so far? Do you have any question? Then we proceed for the heart rate. If the distance between two heart waves, you have this ECG. First of all, let me know where is this patient right now? He is in safe hand. Anybody taking care of him? I hope that the patient will be with our team, and he will be having a proper management right now. And so far as heart rate is concerned, if we have regular heart rhythm, that distance between two R waves are regular, then in order to calculate the heart rate, we divide 300 divided by number of small squares between two R waves. In this case, there are 4 large squares between R and R waves. So in this ECG, we have heart rate of 75 per minute. Then in each ECG, in each wave, the P wave should be P wave should be present, and QRS complex should follow the P wave. So in this ECG, and this is sinus rhythm. So this is ECG is of sinus rhythm. And then I will discuss at the end of S wave to the start of T wave, there is ST segment. In this ECG, we can see that there is in lead V1, V2, and V3, there is ST elevation. And in 2 consecutive chest leads, if there is ST elevation of more than 2 mm, it is significant. And there are also reciprocal changes present, which we can see that there is ST depression in lead 2, 3, and AVF. And ST depression of 0.5 mm, more than 0.5 mm is significant. So this patient is having extensive anterior MI with reciprocal changes. Okay, so we will keep this patient in resuscitation room. And I forgot to tell the axis. If in lead V1, in lead 1 and 3, there are positive deflections, dominant R waves, it is normal axis. If lead 1 is positive and lead 3 is negative deflection, it is left axis deviation. And if lead 3 is positive, dominant R wave, and lead 1 is non-dominant, then it is right axis deviation. And if both are negative deflection in lead 1 and lead 3, these are extreme axis. We will keep this patient in resuscitation room. We will urgently call cardiologist. We will activate the cath lab,
Thank you.
and we will give him
Thank
oxygen.
you.
We will give him morphine.
Thank you. Your time done. How many marks, guys, you will give Kashif?
And sir,
They didn't complete the task.
Didn't complete the task, and also a 9.5. He didn't ask about the safety of the patient. Where is the patient now?
he
He asked
he
about
asked,
he
he
asked,
asked
he
and he complete.
He asked immediately when he saw the
He
ECG.
was lying for not completing the task.
I think he should get 10.5. He completes the task.
So in the beginning, I did not show him the ECG. This sometimes happen in the exam. So how to avoid this point? If the actor did not show you the ECG, so you can introduce yourself, and then I believe you have something to discuss with me regarding interpretation of ECG, right? He will say yes. Then ask him, where is the ECG? Clear? Clear, guys?
Okay, we
Yes,
have to
sir.
ask if they don't provide, or we will start, Dr. Sami.
Better to ask him, where is the ECG? Okay.
Oh,
But don't think about the diagnosis. Okay.
okay.
If you know the diagnosis, okay. If you don't know the diagnosis, continue. Okay. So Kashif, he did well. He explained to me about the leads and blah 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 blah. I want you to ask about the ECG for one reason. Why? Because when you tell him we have 12 leads, it means you are showing him and applying on the ECG paper, right?
Yes, sir.
Yes.
How you will teach him without ECG paper? It means you don't have teaching skills. Clear?
So sir,
Yes,
from
sir.
the start we will ask if there is any ECG.
Yes, of course. So
Okay.
the teaching skills, do you think if I'm not showing you the ECG, is it logic? No. Okay. So how to be good teacher? You have to depend on visual teaching. Okay, visual teaching and auditory teaching. Visual means I will show you. Auditory means I will give you voice. Okay, so pausing, it's a good teaching skills. Basis of information, good teaching skills. Okay, so anyway, he did well, but he did not complete the task. Why? He is giving too much information, right? The ECG is
Yes.
blah 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 blah. No need. Did I mention that in the beginning of this session, Kashif?
No.
No, sir.
So no need. If I did not mention any point, means it's not important. Clear? Okay.
Yes, sir.
Just to follow the most important points. So you have two channels. You have access to two channels. One ideal channel, and if you will follow the ideal channel, you will not get 10 out of 10. But if you will follow the concise channel, you will get 10 out of 10. The non-concise channel, it will help you in general, in real practice also. Did you get my point?
Yes, sir.
Yes, sir. Yes, sir.
Okay. So focus on the concise channel because it's saving time and to the point. Okay. But if I will give you concise channel only, not good. If I will give you non-concise channel only, not good. So both of them, you will understand which in detail, which in concise. Clear? Okay. So for the purpose of the exam, if you want to get very high score, you should mention very important points in any station. So here, if you will discuss about ST elevation, in which point?
A point.
In segment.
Waves. We have leads, we have seconds, we have squares, we have waves, right?
Yes, sir. Yes,
So
sir.
If you will go for the point of waves, you can say normal waves BQRST. Then you will focus on T, the normal TST segment, like V5, for example. You can choose one normal lead. You can choose one normal lead. Okay. So, for example, you can choose V4, V5, V6. Normal or abnormal, guys?
Normal.
Normal. So explain to him about ST segment. So if you find ST segment in the same level of B, okay, so it's a normal. Then give him one example of ST elevation and one example of ST depression. So you can say like that. If you see V5, you will find ST segment the same level of the B wave. Okay. So this is normal, but in V2, for example, in V1, V2, V3, V4, you will find ST elevated above the line of B, okay? In lead 2, 3, AVF, ST depression, it's below the line. Clear, guys, how to teach?
Yes, sir.
Okay. Then, if you find ST elevation in some leads, and ST depression in some leads, so it's confirming it's MI. Okay, how to diagnose MI? So you have limb leads, you have chest leads. If you find more than 2 leads in limb leads, more than 1 mm, and in chest leads, more than
2
2
mm.
mm.
2
4.
mm.
Excellent.
2 mm.
In limb leads, 1 mm. In chest leads, 2 mm.
2 mm.
Easy?
Easy.
So no need to talk about BR, no need to talk about QRS, no need to talk about T wave. Just to focus on ST segment because the diagnosis is
MI.
MI,
STEMI.
STEMI. Okay. So in previous ECG, no need to talk about ST because it's irrelevant here, right?
Yes.
You will talk
Yes, sir.
about B wave, you will talk about QRS, you will talk about the most important points relevant to SBT. Clear, guys? So you will focus on the relevant points relevant to the diagnosis. Okay. So regarding B wave, QRS, and the finding here, in which point in SBT, in which point?
Excuse me, sir, again.
The
In
point
waves.
Rate.
Waves, sir.
waves.
Heart
Wa-
rate and waves.
Waves. Okay. Then if you go for heart rate, also it's relevant. Okay. Okay. Excellent. Okay. So you did not reach the management plan. So what is the management plan, Kashif?
So we will keep the patient in resuscitation room
Okay.
and apply high flow oxygen, give morphine IV, and give aspirin 300 milligram per oral, clopidogrel 300 milligram per oral, and call cardiologist, activate cath lab. And if cath lab facility is available within 120 minutes, we will go for PCI. If cath lab facility is not available within 120 minutes, then we will go for thrombolysis. And we will admit
Okay,
the patient
thank
in
you.
CCU.
Thank you. You have problem. You have problem in your approach. What is the problem? You want to mention everything. Okay. You are very knowledgeable and you want to mention everything. This is not good for any exam. Clear?
Okay, sir.
So I want you to mention the highlights. For example, the general approach. So CAS lab you will mention in all stations?
No.
No, sir.
No, don't mention now. It's not important. Did you get my point?
Yes, sir.
I want you to mention first the general approach. Clear? So,
Yes.
Yes.
keep the patient in resuscitation room, connect to cardiac monitor, examine the heart and the lung, take blood sample, including
Yes.
cardiac enzymes,
Cardiac enzyme.
call cardiologist. Now I finish the general approach, right?
Yes, sir.
I will go for specific management. Give the patient 4 aspirin or 300 milligram BO aspirin, 300 BO Belavix, then activate cath lab. Easy.
Yes, sir. Thank you.
If you finish the time and you finish the general approach, you will get 10 out of 10.
Yes, sir. Noted.
So
Thank
I
you, sir.
want you to mention the most important points. If you finish the most important points, now you are in safe side. You will get 10 marks. If you still have time, it's up to you. You can mention further details, no problem. Okay?
Okay, sir.
Yes. So if you mention all the approach, I will give you 10 out of 10. But because you did not finish the task, I will give you 8 marks. Okay?
Okay, sir. Thank you.
Thank you, Kash. Okay, next one. Who did not practice?
Me, sir.
Okay,
Rudra.
okay. So you can take 30 seconds and 6 minutes.
I can start, sir.
Okay, you can start.
Okay. Good morning. I'm Dr. Rudra, one of the ED staff. Can I confirm your name and grade, please? Okay. Nice to meet you. I believe you have something to discuss with me regarding ECG interpretation. It's a very important topic. So how much do you know so far? Okay. Anything specific you want to learn? Okay. So I will teach you about ECG interpretation. I will set up the objectives. I will teach you about the ECG lead in the ECG, the squares, and the waves. And then also I will teach you about the heart rate, the rhythm, the axis, and then the diagnosis. And then I will let you know the management plan. Is that okay? Okay. So about the leads, there are 12 leads, 6 limb leads, and 6 uh, chest leads. So the 1, 2, 3, AVR, AVL, and AVF are the limb leads, and V1 to V6 are the chest leads. Okay. Then about the time, each
Ask about the
each
ECG.
yes. Yes. So where is the ECG? Do you have the ECG? Okay. Okay. So as I said, there are 12 leads. 1, 2, 3. AVR, AVL, and AVF are the limb leads, and V1 to V6 are the chest leads. And each leads has time of about 2.5 seconds. And there is another leads which is not in here, which is the rhythm strip, which is about for 10 seconds. Okay. So and each large square is about for 0.2 seconds, and in each large square there is 5 small squares, which is about 0.04 seconds. Okay. Then as you can see in lead 2 about the waves, you can see the P wave, and then you can see the QRS complex, and then you can see the T wave. So the P wave, it represents atrial repolarization, and the QRS complex, it represents ventricle depolarization, and the T wave, it is represents ventricular repolarization. So since it contains all the P, QRS, and T, it is a normal sinus rhythm. Okay. So about the heart rate, you can calculate by calculating number of large squares between two R waves. So in this, as we can see, there is almost 5 large squares. So the heart rate will be around 80. And then let's go for the axis. So we consider the lead 1 and lead 3. If both are R dominant or positive, it's normal axis. If you have only R dominant in lead 1, then it is left axis. And if you have only R dominant in lead 3, then it is right axis. And if both the leads have negative waves, then it will be an extreme axis. So in the as we can see in lead V2, the QRS it's it's it it is quite large, so it's almost covering more than 1, 2, 3, 4. The S wave is considering more than 5 large squares. So this is probably an ECG showing LVH. It has LVH criteria is so it's possibly an LVH. ECG showing LVH. Okay. So regarding the management plan, we will keep the patient in the resuscitation room. We will connect cardiac monitors, do a examination of the heart and the lungs, and check the vital signs. And we will call the cardiologist, and we will check the blood pressure, and we'll if it's high, then we'll take it accordingly. So is that clear to you? Do you have any questions? Okay. So as I said, I will just recall you. The most important is to know about the waves and the leads and the
Okay,
time.
thank you, brother. Okay, how many marks, guys, you will give, brother?
8.
Why?
Because he didn't diagnose the case because there is a Drager waves and along with the left ventricular hypertrophy, he didn't mention the criteria of left ventricular hypertrophy. That is the S wave in the V2 and the R wave in the V5 more than 7. He didn't mention it. And then regarding the management, what is the management of the Hukum? He didn't mention it. And
Mention general
in the
management.
initial part, he didn't ask about the safety of the patient.
Okay. What else?
And also about anything specific he want to learn patient student.
He put the general management he did, but the Hukum he did not verbalize the criteria for Hukum.
Did
But
he
general management,
did he discharge the patient?
no, sir.
No, not mentioned.
He kept the patient in resus?
Yes, sir.
Yes, sir.
He
Yes, sir.
connected the patient to monitor?
Yes,
Yes,
sir.
boss.
Yes.
Yes,
He
sir.
examined the heart and the lung?
Yes, sir.
He did blood test, including cardiac enzymes, electrolytes?
No,
No,
Did he
No, sir,
no, sir.
no.
did he call
No.
the cardiologist?
Call the
Yes.
cardiologist. Yes.
I will
He
give
called,
him
sir.
I will give him 10 out of 10.
Oh, excellent.
Yes. So if you follow the general approach, even you did not mention the diagnosis, no problem. You are safe, doctor.
Yeah.
You are intelligent. You are professional.
Thank you so much.
Okay. So the cardiologist, he will come and catch the problem. Easy.
Yes, sir.
The most important, you did not discharge the patient, right? Okay.
Yes, sir.
This happened. Some doctors, our students, they did that. They did not mention the diagnosis and they got 10 marks. They gave me the feedback. They said I did not mention the diagnosis and I got 10 marks. Okay. And they mentioned in the group, maybe the group of 20, 22, something like that. Okay. Maybe you are not added in this group. Okay. So the most important to be safe, doctor. Follow the general approach. Be skillful, be fluent, be organized and follow the general approach of teaching. So pausing, giving information in pieces, check understanding, try to recap, mention the likely points. Okay, okay, well done. So this one is Hawcom. Why Hawcom? Because Q waves were in lead 2, 3, FF, right?
Inferior.
Yes.
Inferior.
It means
Not inferior. This is Q wave, Drager waves.
wait, guys,
Dagger. Dagger. Shoot.
seconds, please. Okay, so regarding this ECG, we have few waves in lead 2, 3, FF, I mean inferiorly. We have also deep S wave, in chest leads, right? And the tall R waves in chest leads. Both of them more than 7 squares. It means LVH. Okay, so how many large squares in R wave? 1, 2, 3, 4, 5 and half. Here, 1, 2, 3, 4, 5, 6. 6 and 5,
11.
11. So it's more than 7, right? It
Yes.
means LVH. If you find LVH and you find deep, narrow S wave, narrow QRS, it means HOCM. Support the diagnosis by Q waves. Clear, guys?
Yes, sir.
Okay. So sometimes you will find inverted T wave or biphasic T wave in some leads. Okay, so this one, what you will do, he needs a definitive treatment of resection surgery, right? Okay. Next one, who did not practice?
Farzeen.
Okay, Farzin. So you have 30 seconds and 6 minutes.
Okay, sir. Thank you. Sorry, should I start?
Okay, you can start.
Hello, good morning. I am Dr. Farzeen, one of the doctors. May I know your name and grade, please? I believe you have something to discuss with me regarding the ECG interpretations. Can I see the ECG, please? Okay, so that's a very good topic to discuss. Can you please tell me what about this patient? Where is this patient actually? Is the patient in safe hands? And have you handed over your patients to the staff as well, to your colleagues as well? Okay, fine, thank you. So today I will tell you about the basics of the ECG. And can you please tell me how much do you know so far about the ECG interpretation? Do you have any idea? Okay, fine. We can start from the basics of the ECG. First of all, we need to set our learning objectives. I will tell you about the ECG in detail. I will tell you about the leads of the ECG, the squares of the ECG, heart rate, rhythm, axis, and of course, the diagnosis of this particular ECG and the management of the patient presenting with this ECG. First of all, it's very important to find out that you are having the correct ECG of the correct patient. And regarding the leads of the ECG, there are 12 leads in the ECG. 1, 2, 3, AVR, AVF, and AVL. These are the limb leads, and there are 6 chest leads: V1, V2, V3, V4, V5, and the V6. Each small lead is about 2.5 seconds, and in the last of the ECG, you can see a strip which can be lead V1 or lead 2 or lead 5, and it's the long strip, and its duration is about 10 seconds. Is that clear? Any question till now? So now I want to tell about the squares of the ECG. In ECG, there is a large square, and the duration is about 0.2 seconds, and each large square has about 5 small squares, and duration is about 0.04 seconds. Now we'll proceed towards the waves of the ECG. There are about normal waves are PQR, PQRST, and there is also segments called ST segment, PR interval. And there is also a QRS complex. So the P wave shows the atrial depolarization. QRS means the ventricular depolarization. The T waves show the ventricular repolarization. Is that clear? Any question till now? And in this particular ACG, if as I told you about an ST segment, it's kind of sloping downwards, but I will tell you in detail when we'll reach towards the diagnosis of this patient. Now I will tell you about the heart rate of the ACG, how to calculate the heart rate. So in a normal, if there is a normal rhythm, you have to calculate the number of the boxes which are coming in the between the two R waves, and divide the number of boxes like 300 divided by the number of boxes coming between the two R waves. So in this particular ECG, the heart rate is around about 100. And now what about the rhythm of the ECG? You have to check the distance between the two R waves. If the distance is regular, then the rhythm is regular. If the distance is equal, then the rhythm is regular. If the distance is variating between the two R waves, then the rhythm is irregular. Also, the presence and absence of the P waves is also important. If the P wave is present, then it is normal. Then if the P wave is regular, then it shows an arrhythmia. Now I will tell you about the axis of the ECG. For the axis, you have to see the two leads, that is one and lead 1 and lead 2. If you find the positive deflection, meaning the dominant R wave in lead 1 and lead 2, then it is the normal axis. And if you find positive deflection in lead 1, then it means left axis deviation. And if you find positive deflection in lead 3, then it is a right axis deviation. And in last, if you find a negative deflection in both lead 1 and lead 3, then it shows the extreme axis deviation. So in this particular ACG, you can see that its left axis deviated towards the left, so it's a left axis deviation. So regarding the abnormalities which can be seen in this ECG, as I discussed earlier, we can see in downsloping ST segment. You can see that the ST segment is sloping downwards toward below the isoelectric baseline in the lead V1, V2, and also in the V3. And there is also a left axis deviation. So, and the heart rate, it is around 100. So these findings are suggested to offer cardiac syndrome. So is that clear? Any question in ECG till now? You want to ask anything? I can discuss with you. So regarding this particular ECG, I want to give you a brief knowledge about the management of this patient. So if the patient with this ECG comes, you have to keep the patient in the research room. You have to attach the cardiac monitor, do the complete examination of the heart and lungs and the vital signs as well. Pass to a large bore IV cannulas and take the blood for hematology, biochemistry, blood gases, toxicology screening, as well as the cardiac enzymes. And also call the cardiologist for the definitive treatment. Is that clear? Any question till now you want to ask? So I want to give you a brief view regarding definitive management as well. If this patient went into some sort of an arrhythmia, we can we can take the patient or admit the patient for the intracardiac defibrillators or a pacemaker, depending upon if it's a bradyarrhythmia, then we can go for a pacemaker. If it's tachyarrhythmia, then we can go for an intracardiac defibrillator. So that's the that is about the ECG and the interpretation of this particular ECG. Any question till now, please let me know. I am here to answer you all your questions. And I will also give you some website and links, and you can just go and have a look at those websites and the links, and you will have a further knowledge about the ECG and particularly about this in this condition. So any question till now? Okay, thank you. Now I will recap what we have discussed. You were here to have a discussion regarding the ECG interpretations, and I told you about how to analyze the ECG. Told you about the waves and the heart rate, squares of the ECG, leads of the ECG, axis of the ECG, and in this particular ECG, there was a diagnosis of suspected Brugada syndrome, and I've also told her how to manage the patient if this patient comes. Okay. Okay, sir. Thank you, sir.
Okay, what do you think, guys? How many marks will give Farzin?
10.
10 marks.
10 or 10.
I will give her the 9.75 because in the waves, he didn't mention about the COVID type ST elevation at that point, but he
Not
mentioned in the
important. You mentioned slope the other day. You mentioned, and this is not important COVID to mention specific COVID.
Okay, so she mentioned down sloping ST elevation. Down sloping, it means ST elevation and the T wave inversion. So you can see here in V1 and the V2 and the V3. ST elevation, and T wave inversion. It's called down sloping ST elevation. Okay. So you will mention that where, in which point?
In waves,
In
it's
waves. Okay. You did not mention that earlier in waves.
yes, sir.
Okay. So better to mention in waves first. So you can say in waves, you should find P, QRS, T. And here B present, QRS present, T, ST normal. But in V1, V2, V3, you can find ST elevated than the level of the line, isoelectric line, and the T wave inverted down, negative deflection, okay, in V1, V2, V3, which is called down sloping ST elevation. This is your point. She should mention earlier like that.
Yes, sir.
Okay. Anyway, if you did not mention in waves, the most important to mention in the end. Okay, so
Okay.
I will give her 10 out of 10, okay?
Okay.
Yes. Well done.
Thank you, sir. Thank you, sir.
Okay. Next one. Who did not practice today?
Yes, sir.
Okay, Ayi,
Yes,
how are you?
I'm okay. Thank you, sir. How are you?
Yeah, fine. Okay, you have 30 seconds and 6 minutes.
Can I start, sir?
Okay, you can start.
Good evening. I'm Dr. A, ED Registrar. May I confirm your name and grade, please? Nice to meet you. I believe you have something to discuss with me today. Is that about ECG? Thank you. And how much do you know so far about ECG? And do you have anything specific you want to learn? Do you have any ECG so I can teach you? Can I see the ECG, please? Yes, today I'm going to set a learning. How much do you know so far about ECG? Right. So I'm going to set the learning objective for you. Today I'm going to teach you about leads, duration, square of the ECG, wave of the ECG, heart rate, rhythm, axis, diagnosis, and the management plan of the ECG, management plan of the patient. And before we start, is the patient all right? Is the patient in there, somebody taking care of the patient? Okay, let's just start about our teaching. So ECG is our routine practice in ED, and we can catch important diagnosis from ECG. So let us start. It has 12 leaves. ECG has 12 leaves, 6 limb leads, which is 1, 2, 3, AVR, AVL, AVF, and then 6 chest leaf, which is V1 to V6. And then the duration of the leads, the one lead is 2.5 seconds, and then at the bottom there is a long lead. That one is 10 seconds. And then there are squares, small squares and large square. One large square has 4 small square. One small square is 0.04 seconds, and one large square is 0.2 seconds. And then there are waves in ECG, which are P, Q, R, S, and T waves. P wave is for atrial depolarization, and the QRS is for ventricular depolarization, and the T wave for ventricular repolarization. Are you following with me? Are you okay? Any questions you want to ask? You can stop me anytime if you are not, if you don't understand. Okay, let's talk about heart rate. So yeah, here you can see the heart rate, and this. Okay, let's just go back to the waves. You see here P wave, and QRS. They are just it is a P wave to QRS. It is so close here. You can see that it is P and QRS is becoming very close. And then okay, let's go to heart rate. Heart rate is we can calculate the heart rate by by counting two continuous R wave, last square between two R wave. That is 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Here is 5 large square between two R wave. It should be 300 divided by that large square between two RR. That is around 60. So heart rate for this ECG is around 60. And then let's go to, we will talk about the QRS. QRS, the slope is so slight, and it is wide. It's more than three small square. It's almost about one large square. So this is a slight and a wide QRS. And then let's just talk about the rhythm. So we are going to this. Let's just check about how to read the rhythm. We have to measure between two RR. If they are equal, like this one, between two RR, that is 5 square, another RR 5 square, that is equal. So this is a regular rhythm. So axis, let's just talk about the axis. And then in axis, if there is any R wave above the isoelectric line is positive deflection. So if the R wave is positive deflection in lead V1 and V3, that is normal axis. If only positive deflection of R wave in lead 1, that is left axis deviation. If positive deflection only in lead 3 is right axis deviation. If they are both negative in lead 1 and lead 3, R wave is negative in both lead 1 and lead 3, that is the extreme axis deviation. Are you okay? Are you getting up to here? All right. So let's just see about this. Like I said, this is a very short PR interval and the SLAR and the wide QRS complex. So prolonged, and that QRS is also prolonged more than three small squares. And then this SLAR wave, SLAR QRS is called delta wave. So this ECG diagnosis is Wolff-Parkinson-White syndrome. So let's go to management. We have to keep this patient in resuscitation room and connect cardiac monitor, and then take the blood for hematology, biochemistry, cardiac enzyme, and then we have to call the cardiologist, and then we have to examine the cardiovascular system and respiratory system, and then specific management, and
Thank
then
you.
the specific.
Thank you.
Thank you, sir.
Okay, your time done. What do you think, guys? How many marks you will give I?
An excellent performance.
10, sir.
10.
Okay, she's organized.
Sometimes it looks like in between.
Okay, she's doing well. Accuracy almost mentioned all the points. Organized and fluent. She covered the diagnosis. Did she mention Wolff-Parkinson-White syndrome?
Yes, she
Did she
picked.
mention type A?
No.
Not.
Is it important?
No.
Yes.
It's
No,
not
not
important.
not important. Because no need to give advanced information in the beginning, okay?
Oh, good.
Yes. So the good teaching skills depend on concise basic information. Clear? Maybe she will teach the junior doctor or the nurse about these points later. Okay? So the most important here, you should mention delta wave. Delta wave. So You will mention delta wave, BR, and the QRS. Where? In which point?
Where?
In waves.
Waves.
In waves.
In waves,
Yes. So after you finish squares, after you finish,
seconds and squares.
yes. So you will go for waves. You can say waves in the ECG. It should be B, QRS, T. Here you find B wave and the QRS and the T, but we can see a different wave here. No need to teach the actor about delta wave. Don't make effort to show him delta wave. Just verbalize. The examiner will understand. So you can say delta wave here between B and the QRS. So for this reason, this slurred wave, for this reason, BR very short. And for this reason, QRS very wide. Clear, guys?
Clear?
Yes, sir.
Yes. So it's Wolff-Parkinson syndrome. You will follow the general approach as I did. And this patient, the general approach, keep in resus, examine heart lung, blood test, heart functions and electrolytes, call the cardiologist, and then the definitive management frequency ablation. Clear? Okay, well done. So,
Dr. Honey, can I ask one question?
yes, sure.
Because in this lead, there is a positive finding of intervals. QRS interval is prolonged, and we should mention the interval at this time. A wave.
You mean QRS?
Yes, because when we discuss about the waves, because here the positive finding also the intervals. Should we mention the intervals at this point of waves?
Here, the most important mention delta wave, a slurred wave between B and the QRS. For
Okay.
this reason, the B are very short
Okay.
and the QRS very wide. Or you can say
Okay.
B are short. No need to say very. You can say B are short and the QRS wide. More than enough.
Okay, I got it. Thank you.
Okay,
Thank you. Thank you so
welcome.
much.
No need to talk about ST because it's not finding in Wolff-Parkinson syndrome. Okay.
Yes.
Okay, so once you find finding, mention that. Okay. I will give you 10 out of 10.
Thank you, sir.
Yeah, welcome. Next one, Omar.
Yes, sir.
Okay. You have 30 seconds and 6 minutes.
Okay, can I start, sir?
You can start.
Okay. Hello, my name is Dr. Omar. I am one of the ED senior. Can I confirm your name and age, please? Okay. Thank you. I do believe that you want to learn ECG. Am I right? Okay. Okay, thank you. May I know how much do you know about ECG? Okay. And is there anything you want to know specific? Okay. May I ask that do you have any ECG with you? Okay. Do you have any ECG? Okay. May I know how is the patient right now? Okay. Is the patient is safe? Someone looking after the patient? Okay. All right. Okay. So let's set our learning object. We'll be teaching. I'll be teaching ECG today, and I'll be discussing the indication, contraindication, complication of the ECG, and then we'll discuss the ECG in details. The basics first, then we'll discuss this ECG specifically. Okay. So the indication is that regarding ECG, if we suspect any problem in the heart or any shortness of breath or any kidney problems, then we can do the ECG. And in research time, we don't do ECG, which is a contraindicated, and there is no complication of ECG. Am I clear to you? Okay. All right. So let's start with the ECG. You can see that there are some waves and there are some segments and there are some interval. So we'll start with the leads. Any idea about the leads? Okay. So you can see that there are 12 leads, 6 chest lead and 6 limb leads. And okay, and You can see that first in the isoelectric line there is a positive deflection which is called P wave, and there is a QRS complex which is called QRS complex, and after that there is another positive projection which is called T wave. Am I clear to you? Okay, thank you. All right. So then we will discuss about the axis, and also we'll discuss about the heart rate. So the axis is that there is two axes, left axis and right axis, and the normal axis. We have to see that is there any lead 1, lead 2, and 3. If the lead 1 and lead 3 are both upside, it means this is the normal axis. And if the lead 1 is upside and lead 2, lead 3 is downside, it is the negative. And if the lead 1 is downward and lead 3 is upward, it is the right axis deviation. Am I clear to you? Okay. Then we can discuss about the heart rate. How can we check the heart rate? So we have to check the QR. We have to check that is that RR interval is regular. Like if you see this ECG, you can see that the RR interval is regular. So in this case, we can calculate the heart rate, the big large square, and divide it from 300. So there is 1, 2, 3, 4, 5, 6, 7. So there is 7. So the heart rate is about 45 or something. So yeah. And there you can see there are some large square. Large square is time is 0.27, 0.20, and inside the large square there is some small square, which represent the 0.04 seconds. Okay, and each lead is 2.5 seconds, and the downside of the strip you can see that there are the whole rhythm strip which represent 10 seconds. Am I clear to you? Okay. So let's discuss this ECG. So if we see ECG, you can see that there are some P wave after that there is QRS, and you can see that there are biphasic T wave. You can see that the T wave inside the in between the QRS there is one upward and one downward. So it seems like so am I the diagnosis right, sir? Okay, so we can see that there is a upward and there is a biphasic T wave. So it's most likely problem in the which is called Wallen syndrome. And for this patient, we need to keep the patient in a research area. We need to attach the patient with the cardiac monitor, and we need to take the blood from the patient, and we need to investigate all the investigation, including the troponin I. And this we need to involve the cardiologist, and we need to give the treatment, like if we need to give oxygen, high flow oxygen. Am I clear to you? Okay. And we need to treat there because there is a chance of left anterior artery dissection. Okay. Okay. Do you have any question? Okay. Hello?
Okay, your time done. What do you think, guys? How many marks?
I mean,
You are angry.
Who?
I made wrong diagnosis.
Omar or me?
You, sir.
No, of course I will not.
Wrong
Hi.
diagnosis, sir, in this case. I
Give him-
believe.
Complete heart
Diagnosis.
block.
It's a complete heart
Complete
block.
heart block.
Yeah,
And the
we have
approach, and he totally forget your approach. Indication, contraindication, complication like this.
Okay. So don't
Training.
don't follow the approach of procedure because it's not procedure. Here the task is
Teaching. Teaching.
Interpretation.
not about
Interpret.
teaching. Yes, teaching, but the task is
Interpret.
interpret.
Interpretation of
it
an
was
Interpretation.
interpretation of ECG.
Not recording.
Did they ask teach how to do ECG?
No.
No, sir.
No.
Interpretation.
Okay, so they said
No.
teach interpretation of ECG. So don't follow the approach, indication, contraindication, and so on. Okay. So here the approach should be I'm Dr. Bilal, one of the ED doctors. May I know your name and the grade? Nice to meet you. I believe you have something to discuss with me regarding interpretation of ECG. Nice topic. How much do you know so far about ECG interpretation? Anything specific you want to know? Okay. Today I will teach you the leads, seconds, squares, heart waves, heart rate, rhythm, axis, diagnosis, management. Do you have any ECG? Oh, what is it? This patient? Anyone taking care about him? Okay. It seems like a heart block. Where is this patient? Okay, like that. Okay. If you don't know the diagnosis, no problem. Ignore the ECG. Clear, Omar?
Yes, sir.
You ignore the ECG. You can get 10 out of 10. No worries. Any ECG in the exam, Brady, it's heart block. Easy.
Yes, sir.
So even you did not mention heart block. So the heart rate, how much here? 300 divided by how many large squares?
7 square.
Around 45.
45.
7 large squares. So the heart rate here is
45.
45. Right, Omar?
Yes, sir.
So it's a heart block. Okay. Is it first degree? Is it second degree? Is it third degree? I don't care. Easy?
Yeah.
Okay. So if you did not mention heart block, you can ask the nurse, this patient has bradycardia. It's a diagnosis or not diagnosis, guys?
Diagnosis.
Diagnosis.
Yes.
The patient has bradycardia. What to do? Follow which algorithm?
Bradycardia algorithm.
Bradycardia algorithm. Easy?
Very easy.
Keep the patient where?
Resuscitation room.
Examine
Heart and
Examine the
lung.
heart and lungs.
lung. Connect.
Cardiac monitor.
Heart monitor.
Call.
Cardiologist.
If the patient is asymptomatic, you will observe. If the patient is symptomatic, you will give
Atropine.
atropine 0.5 milligram up to
3
3
milligram.
3 milligram. If not effective, you will give
Transcutaneous pacing.
isoprenaline. If 5 microgram per minute or adrenaline 2 to 10 microgram per minute. If not effective,
Then pacing.
Pacing.
transcatheter pacing
Transcatheter.
and call the cardiologist for
Transvenous pacing.
transvenous pacing.
Transvenous pacing.
You can get 10 out of 10 or not.
Yes.
Yes.
Very easy. Okay. Killer Omar?
Yes, sir.
Okay. So here I will give you how to catch the problem in heart block. Okay. So you have R. It's very obvious. R. Okay. How many waves between R? Here, for example, this R and this R. 1, huh?
2,
2,
Three.
3. If you find the 3 waves, it means drop the QRS. Easy?
Easy.
Yes, sir.
Yes.
If you find 3 waves, it means drop the QRS. So the large wave, B or T?
T.
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 The large is T. And
T.
the wave after QRS, T or B?
P.
P.
T.
P.
After QRS.
Cure T. T.
You have confusion between B and T.
Chai, T.
Okay. So the wave after QRS, T, and the large one, T also. Okay.
Yes.
This one large and after QRS, so it's a T for sure. Okay.
Yes.
Yeah.
And this one small, so T or B?
P.
It is
P.
P. Pakistan.
And this one small, T or B?
P.
P.
B.
B.
Okay. So we have one T and two B.
P.
It means after any B should be QRS, right?
Yes.
Yes.
So drop
Yes.
QRS here, right?
Yes.
Easy.
Very
Yes.
easy.
Any
Mashallah.
B wave should be followed by
QRS.
QRS.
You are it.
okay. So here, for example, how many waves? 1, 2.
3.
Here, very short BR. It seems like inside the QRS. Okay. So we
Yeah.
have T wave and then B wave. Any B wave should be followed by.
QRS.
You are it.
So
QRS.
drop the QRS here, right?
Yeah.
Yes.
Easy now.
Yes, sir.
Okay. So we have atrial rate and the ventricular rate. The same, should be the same. Ventricular rate, it means the 300 divided by 1, 2, 3, 4, 5, 6, 7. So 45. Okay. The ventricular rate, it means 300 divided by large squares between R. It means here 45. Okay. And atrial rate, it means the 300 divided by large square between B and B, right?
Right.
Yes.
Yes.
So how many square? 1, 2, 3. 1, 2, 3. Okay. The start of B wave here, right?
Yeah.
1, 2, 3. So 300 divided by 3?
100.
100.
So the atrial rate how much?
100.
100.
Ventricular rate how much?
45.
45. So it's a complete heart block. Okay. How to confirm it's a complete heart block? Check the BR equal or not equal.
Not
Unequal.
equal. Unequal. Look at that rhythm strip last.
Okay. So this BR, this very short, this one short, this one short, this one very short. Okay. So it's not equal.
So, Dr. Hani, in bradycardia, PR, there should be prolonged, no? But in complete heart rate, can be PR is always short? Can this,
In first degree,
yes.
no drop the QRS, right?
Yes.
Yes, sir.
First degree, it will be very prolonged, but
No
it
drop
Fixed.
Q.
no
Fixed.
drop the QRS. Okay.
Yes.
In second degree type 1, you will find BR prolonged, then more prolonged, then dropped only
Drop.
QRS, one only. But here QRS dropped, dropped.
Yes.
QRS
Yes, sir.
here dropped many times. Okay. And in type 2, second degree type 2, you will find PR interval equal,
Okay.
and
Yes.
QRS not dropped like complete heart block. It will not in all leads like that. Clear?
Mm-hmm.
Yes, sir. Yes, sir.
Okay. So do you think PR this one the same as this one?
No.
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 Do you think like this one? BR
No.
here, it's like
No.
inside QRS.
Yes.
Clear
Mhm.
now? Is it
Yes,
like
sir.
this one?
No.
No.
Did you get my point now?
Yes,
Yes.
sir.
Yeah.
Got it.
So if you find the dropped QRS to be the conclusion, if you find the dropped QRS, think about third degree or second degree type 2. Easy?
Yes, sir.
If you find the dropped QRS, you have two differential diagnoses. Number one,
Second degree to
Complete
third
heart block.
third degree or
second degree.
Second degree type 2.
Type 2.
excellent. If how to differentiate between them? If you find BR equal, it's a second degree. If you find BR not equal, it's a third degree. Clear?
Yes.
Very easy.
Yes.
I am giving you treasures.
Yes, sir.
Okay. So this one, if you don't know the diagnosis, no problem. Okay. But here to show the examiner that you are professional, you can say we have three waves here, T and B and B. It means the QRS dropped. Okay. So check the heart rate. Heart rate, it means atrial rate and ventricular rate. So I will discuss about these points where, in which point?
In wave.
Waves,
Waves.
No.
because
In
drop.
interval.
Heart rate.
Oh my God. Okay.
Oh, right. Yeah.
We are talking about atrial rate and ventricular rate. So in heart rate,
Oh,
right?
yes, sir. Yes, sir.
Okay.
Yeah.
In previous ECG, I will talk about heart rate. I will mention only the heart rate. I will not comment on atrial or ventricular, right?
Yes, sir.
But in any bradycardia, I will mention about atrial rate and ventricular rate. Only in bradycardia. Clear now?
Okay, sir.
Yeah.
Easy?
Easy, sir.
Yeah. So in MI, no need to talk about atrial or ventricular. But in heart block or any bradycardia, you should mention the atrial rate and the ventricular rate and to compare between them. Okay. So you will discuss about waves. And once you talk about waves, you will say B, QRS, T. But we have here B without QRS. It means the QRS what?
Dropped.
So we will discuss about this point in waves. Then we will go for heart rate. We will discuss about atrial rate and ventricular rate. I wish it's clear now.
Yes, it is
Okay.
clear now. Thank you.
Yeah. Okay. Next one. Who did not practice today?
Can I practice?
Okay, sure. Okay, Riyadh. You have 30
Yes.
seconds and 6 minutes. This is the last station, guys, okay?
Sir, I didn't.
Who did not practice?
Muhammad.
Me. I didn't practice.
Okay, Riyadh and Muhammad, and then we can start. You can start?
Okay, good morning. I'm Dr. Riyadh. May I know your name and your level? I believe that you want to know about ECG today. Is that right? Okay, it's nice topic. What do you know so far about ECG? Anything specific you want to know? Okay, so what is the ECG now? Okay, so what about the patient here? Is he in safe hand? Okay, so we start we establish learning objective. Then I will give you the diagnostic, the management, and at the end I will give you website and flyer and about ECG teaching. Is that right? Okay for you? Okay, first, before starting ECG interpretation, we need to check the name of the patient, the date, the time, and we need to speak the criteria regarding ECG. The voltage and the speed should be 25 millimeter. Okay, then we need to have 12 lead ECG. So it will be 6 precordial, V1 up to V6, and 6 limb ECG, V1, D1 up to D3, and VL, VR, VF. And we need to check the the duration. So this the small derivation normally lasts 2.5 seconds, and the last lead lasts 10 seconds.
And then we need to know about the square. We have big square and large square. The big square is 0.2 millisecond, and the small square is 0.4 seconds. So 5 point small square equal to big square. This information important because we need to know about the rhythm and the is it يعني for the duration of the waves. So we have here PQRS. So the P waves is for atrial depolarization. We have here the PR segment here, the distance between the P and the R. Here it seems irregular and prolonged. So, and we need to speak about QRS. Here we have it's regarding the ventricular depolarization. Here it's large. So we need to speak about T waves. It's regarding the ventricular repolarization. We need to assess also heart rate and heart rhythm. Here we need to assess heart rhythm between distance R. So it seems 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's almost 30 beats per minute. So it's complete heart block. Normally each QRS should be preceded by P waves. So some QRS are not preceded by Q waves. So we need to also to assess the axis. The axis here, lead 1 is positive and lead 3 is positive. So it's normal axis. And we need to assess the PR segment normally should be 3 to 5 small square. Here it's more than that, so it's complete heart block. And so the diagnostic is complete heart block. We need to keep patient in resuscitation room, connect to monitor, give high flow oxygen, examine heart and lung, blood investigation, including cardiac enzyme, and we need to call cardiologist, and we need to consider transcutaneous pacing. Meanwhile, we can give him patient with atropine 0.5 milligram repeated every 5 minutes up to maximum dose 3 milligram. And if not working, we need to give patient adrenaline to 10 microgram per minute until the transcutaneous is pacing. And after that, the patient we need to have definitive treatment, which should be transvenous peritoneal. Is that clear up to now? Do you want me to repeat anything? Do you have any any question? Okay, let's summarize. So the ECG is there are 12 leads in ECG. We need to assess the rhythm, the rate, the duration. We look quick estate the segment, PR segment. We need to consider the axis. And so did I miss anything? Okay, thank you.
What do you think, guys? How much you will give Riyad? How many marks? Hello, can you hear me, guys?
Yes, sir.
How many marks you will give Riyad?
9, sir.
Why?
The only missing thing is he pointed out the waves. He discussed about the in waves the dropped QRS complex. Also, he missed AV dissociation in the rate. This is the only missing point. Otherwise, all he points, he follow your approach and discuss all the till the management. He finished with the task.
Okay. I think Riyad, you did well. What is the diagnosis of this ECG?
Complete heart block.
Okay, why complete heart block?
Because there is AV dissociation. Each QRS is not preceded by P segment, and P segment is irregular. It's not prolonged. It's not drop. So it's not. But it's two. It's a complete heart block, and the rhythm is 30 beats per
So
minute. So
you should mention. Wait, please. You should mention the heart rate should be atrial rate and ventricular rate, right?
yes, yes.
Okay, first we'll go for waves. Should be B, Q, or ST. So we have B, this one B, this one Q, or S, this one
T.
T. Inverted or normal?
Inverted.
Inverted.
Okay. And then this one
P wave.
B wave. Okay. This one
This is T wave.
inverted.
Inverted.
This one
P wave.
and this one.
P wave.
So QRS T P B. It means QRS here dropped.
Dropped. Yes.
Okay. So if you find three waves, it means dropped after P wave. Okay.
Yes,
So
sir.
the ventricular rate, it means 300 divided by R large square between RR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So 27. The ventricular rate 27. Clear, Riyad? You should mention like that. The atrial rate 300 divided by large squares between
Two P wave.
B and
Two
B.
P waves.
So B and B. 1, 2, 3, 4, 5. 300 divided by 5?
60.
60. So the ventricular rate 27 and the atrial rate
60.
60. So now it's a complete heart block. You have to support your diagnosis. How? Check the BR interval. This BR equals this BR?
No.
Equals this BR?
No.
Clear now? So
Yes, sir.
if you find the drop the QRS and the BR not equal, and you find atrial rate not equal the ventricular rate, this is complete heart block.
Yes, sir.
By this way. So you will catch the problem in waves first and then in heart rate. Okay, I will give you 7 marks because you are irritable. I can see you are irritable. Okay, I can see Riyadh.
Yes.
Or I feel.
No, normal.
Okay. So you did not optimize the approach. So I will give you 7 marks. Okay. Well done. Thank you. Next one, Muhammad.
Yes.
Okay. ABG. So the general approach of ABG. Good morning. I'm Dr. Blah blah blah, one of the ED seniors. May I know your name and the grade? Nice to meet you. I believe you have something to discuss with me regarding
ABG.
no ABG interpretation.
Yes, sir.
Okay.
Okay. So is it ABG or ABG interpretation?
ABG interpretation.
ABG interpretation.
Yes. Okay. So I will anything. Sorry. How much do you know so far about ABG interpretation? Okay. Anything specific you want to know? I will set learning objectives for you. Today, I will teach you ABG interpretation. I will teach you the normal values, pH, PO2, BCO2, HCO3, potassium, sodium, lactate, physics. Then I will teach you the diagnosis of ABG, then diagnosis of the condition, then the management of the condition. Clear, Muhammad?
Yes, sir.
Okay. So pH normal 7.35 up to 7.45. If less than that, acidose. If more than that, alkalose. This one 7.5, so it seems alkalosis. Then BCO2, the normal is 35 to 45. If less than that, respiratory alkalosis. If more than that, respiratory acidosis. So this 150, it's respiratory acidosis. Okay, BO2 normal 80 to 100. If less than 80, it's hypoxia. If less than 50, it's a respiratory failure. Okay, HCO3 normal 24 up to 30. If less than that, metabolic acidosis. If more than that, metabolic alkalosis. So 35, it's metabolic alkalosis. Potassium 3.5 up to 5.1. If less than that, hypo. More than that, hyperkalemia. So 3, hypokalemia. Sodium 135 up to 145. So this is low normal. Low normal, it means normal, but in the borderline. Lactate less than 2 normal. So 2 borderline. Basic cis if should be -2 up to +2. If less than that, metabolic. It seems like bicarb. So if less than that, metabolic acidosis. If more than that, metabolic alkalosis. Clear, guys, until here? Okay. Then we will go for the diagnosis of ABG. So here we said alkalosis, metabolic alkalosis, respiratory acidosis. So you can say metabolic alkalosis, partial compensation. So how to catch this one? So you will talk about compensation to the patient. So you have 3 points. You can write, guys, 3 points. Number 1, if you find BH, BaCO2, HCO3. How many components now?
3.
3. If you find the 3 components acidosis, it means mixed acidosis. If you find the 3 components alkalosis, it means mixed alkalosis. Easy?
Easy, sir.
Okay. Then you go for 2 components. Number 2, you go for 2 components. It means CO2 and
Bicarbonate.
CO3. If you find both high or low, what does it mean high or low? CO2 high or not high?
High.
CO3 high or not high?
High.
So if both high, it means a partial compensation. Easy?
Is
Yes.
Yes, sir.
If both high or both low, it means a partial compensation.
Yes, sir.
Okay. Then number 3, CO2 or CO3, any of them normal? Normal, it means uncompensated. How many points now? 3.
3
Three.
points.
3 points. Number 1, BH, CO2, CO3. If all acidosis, what does it mean?
Mixed acidosis.
mixed acidosis.
If
Milk
all
acidosis.
alkalosis,
Mixed alkalosis.
finish the number 1. Number 2, CO2 and the CO3. If both high or both
Low.
low, what does it mean?
Partial.
It means partial compensation.
Compensation. We finish the number 2. We will go for number 3. CO2, CO3. If any one of them normal, what does it mean?
Uncompensated.
Easy?
Easy.
Yes, sir.
Okay. So how to manage this patient? The patient has metabolic alkalosis and partial compensation. He has vomiting. So you should mention the diagnosis first. We already finished the diagnosis of ABG. Diagnosis of ABG, it means partial compensation metabolic alkalosis. Partial compensation, what does it mean? As we said, the CO2 increase in the same direction of CO3 to compensate. Okay, So what is the diagnosis of this patient? 3 weeks vomiting. So you should check the onset. He has vomiting and his age is 3 weeks. So if the vomiting since birth, so it's a hypertrophic pyloric stenosis until proven otherwise. If the patient has vomiting for few days, it could be gastroenteritis or sepsis. Easy?
Easy, sir.
So you check lactate. Lactate 2, likely to be sepsis or unlikely?
Unlikely.
Unlikely. Okay.
Likely.
So unlikely. Okay.
Unlikely to normal.
It's a borderline. Borderline. It should be less than 2, but 2 we cannot say sepsis, right? We should
Okay.
check the heart rate, the other points of sepsis. You should discuss with the actor like that, right? Okay.
But
So any patient with that fixes this management plan. You will keep the patient in resuscitation or in observation. Observation. No need for resuscitation here. So in observation, you will give oxygen and the fluids, right?
Yes, sir.
You will take blood sample for investigation, like full blood count, septic screen, blood culture also, right? Okay. You will do ultrasound if suspected congenital anomalies, if the patient has vomiting since birth. We don't have idea about the onset here. Okay. Clear this station?
yes, sir.
Okay, Muhammad? Muhammad?
Yes, sir.
Okay,
I'm audible, sir.
you can start.
Good morning. Hello, my name is Dr. Tahir. I am the ED registrar. May I know your name and level, please? Nice to meet you. I have informed that you want to learn about the interpretation of ABGs. Is it right? Okay, that's great. How far do you know about the ABGs? Okay. Is there anything specific that you want to learn about the ABGs? Okay. So I will tell you about the ABGs. Is ABGs available? Okay. We will learn about in the ABGs like pH, PSO2, PaO2, bicarb, potassium, sodium, lactate, and base excess. Okay. So first of all, I will tell you about the normal values. The normal value of pH is 7.35 to 7.45, and for the level normal value of PSO2 is 35 to 45, and PaO2 is 80 to 100, and for the bicarb it is 24 to 30, and for potassium it is 3.5 to 5.1, and for the sodium it is 135 to 145, and for lactate it is 2 less than 2, and for the base excess it is -2 and +2, normal range. So in this case we can see that pH is on higher side, so it is alkalosis, and we have to dig out either it is respiratory or metabolic. And we can see that bicarb level is high, so it could be the metabolic alkalosis, as well as the PSO2 is in a higher range, so we can comment on this about the compensation. And potassium level is also low, and sodium is in normal range, and lactate is on the upper normal level, and base excess is on high level. So base excess is on high level, and bicarb is high, and pH is also on high level, so it is likely the metabolic alkalosis. And now we can see about the compensation. If PaCO2 and bicarb both on the same side, on the lower side, then it is partial compensation, and if they both are on the higher side, then it is also sign of partial compensation. And if values of pH, PaCO2 and bicarb is in the same direction of the acidosis, then it is mixed acidosis. And if they are on the same direction of the alkalosis, then it is mixed alkalosis. And if PaCO2 and bicarb, anyone if on in the normal value, then it is uncompensated. And we can see in this patient, patient has the partial compensation. And about the diagnosis of this patient, we have to take the history. Either patient has the vomiting from the birth, since birth, or it is from last few days. If it is from the birth, then it is the most likely surgical cause, congenital hypertrophic pyloric stenosis. And if it is for the few weeks, then it could be the medical cause like gastroenteritis. It could be the sepsis, but here lactate level is normal, so it is unlikely sepsis. So what we will do, we will move this patient to the observation room, and we will attach the oxygen, and we will give the fluids, and we will call the we will do the call the pediatrician as well, and we will do the full blood count, urea electrolyte, and detail LFTs and as well as RFTs, kidney function and liver function test. And we will manage this patient according to the diagnosis, and if needed, we will go for the imaging as well if it is a congenital cause, like for the tummy scan. Am I right? Have you understand about the ABGs and the management of this patient? Do you want to ask more? Okay, let me recap. We have learned about the ABGs and about the pH, bicarb, and PaCO2 normal value, and as well as the electrolyte normal values, and lactate and base excess values. And here we can see this is the metabolic alkalosis with partial compensation. And we have comment on this. This is most likely either surgical or medical cause. So we have to take the history, and then we will move this patient in observation room, and we will manage him according to the diagnosis. Is it right? Do you want to ask more? Okay, thank you.
Okay, so what is the diagnosis of this ABG?
The diagnosis of this is metabolic alkalosis with partial compensation, as
Okay,
well as the partial.
and how to know about compensation? Okay, your time done. Okay, how to know about compensation?
As we can see, the normal value, both values of PaCO2 and bicarb moving in the upward direction from the normal values. So it is the in the same direction, the upward value. So it is the compensation.
Partial
When
compensation.
they will
Partial compensation.
Partial compensation.
Mm.
If you find all in the same direction and pH became normal, so it's a compensation.
it's complete.
Is this pH normal or abnormal?
Abnormal. High.
Abnormal, it means partial compensation, right?
Yes, sir.
Maybe after minutes or hour, maybe the patient deteriorate or compensate. Clear?
Yeah. Yeah, sir.
Okay, so how many marks, guys, you will give Muhammad?
10, sir.
Okay, so I think the approach of ECG is clear and the ABG is clear. We will stop here, guys. Any other ABG we can practice in mock exams, okay?
Inshallah, sir.
Okay,
Thank you very
so
much.
welcome. Inshallah, tomorrow we will practice joint examination, and if we have time, we can practice system examination, okay?
Thank you, sir.
Okay, thank you.
Thank you.
Thank you, sir.
Today you have given us the more time. Thank you so much.
Okay, you are welcome, guys.
Same
Thank
time
you,
to
sir.
everyone.
Thank you, sir.